3D printing is not a dream. It is not a toy, and it hasn't been invented 2 weeks ago. In fact, it is already a production technology. 3D printing has a big impact on a lot of markets, especially for the medical sector. But can 3D printing really be the rebirth of current medical practice? Well, medical practice has changed a lot over the years. And let me show this to you. This is a picture of how our operating theater actually looked like 100 years ago. Exactly, 100 years ago. And well, what you can see on this picture is that the surgeons are operating on the patient amongst the classroom with all the students. And what you can notice as well is that, well, everybody or nobody is wearing actually a mask or wearing gloves. So it's not a very sterile environment like we would know it today. And what you can notice as well is that there's very few and, well, nearly no technology involved at all. This is how an operating theater actually looked like today. It's one of the pictures I took from Google. It's actually a German operating theater. And what you can see there is, well, today there's a lot of technology involved. And, well, more or less, if you've been there already from, well, work or as a patient yourself, well, you would have noticed that there's a limited amount of staff, actually. 1, maximum 2 surgeons, an anesthesiologist, a couple of nurses, maximum 2, maybe a technician, but that's it, and maybe an intern, of course. And there are nearly more screens than medical staff, actually, today. And over the years, well, new technology has been introduced to operating theater and in the medical practice. And, well, surgeons and doctors have always been very careful about introducing a new technology. And with 3D printing, well, a lot is happening, and we will see this together during my presentation. But the future actually might look like this. And what you can see here on this picture, well, it would be actually one surgeon with his patient, no other staff, and one 3D printer. And what you can see as well is that, well, there's something happening with a 3D printer. It's a bit like you would know with your home printer, your paper printer actually, when there are 2 papers being, well, printed at once or missing ink, for example. You know this as well. And, well, with this organ or 3D bioprinter, there's an issue here as well, a technical problem. And a lot of organs are coming out of this printer. And, well, the surgeon, of course, wanted only one. But maybe this is how the future might look like. Now, what is actually 3D printing? Now, let me explain this to you a bit. 3D printing is a process, a technology, where a 3D file is first sliced into a couple of thousands, even 10,000s of 2D slices, and then interpreted by the technology itself and reproduced layer by layer. And we can use today ceramics, metals, and polymers, all kinds of materials actually today, to recreate an object that is very complex, highly complex. In fact, it is that complex that we can customize a product entirely. And for the medical practice, this has a huge impact, actually. Being able to customize a product, well, gives you the possibility to create something that is patient-specific. And one example, well, in the current practice today, did you know actually that the hearing aids that are produced today, well, 96% worldwide of those hearing aids are produced by 3D printing? This represents yearly about more than 10 million parts that are produced on those technologies. So what you can already, well, think of this technology is that it is a real production technology. This is how it looks like. So this is actually one of the hearing aids as it is printed today. And, well, the material here is a liquid resin, actually. And, well, it has to be cleaned afterwards, and a couple of support structures, as you can see there, have to be removed. And then it's, well, transferred to the specialists as well, and they use it for their own patients, so there's a little marking there as well on the product, but it's patient-specific. And if you look at the people sitting next to you, on your left, on your right, well, you notice that we're all different. We're all individuals, except if we're twins, of course, perfect twins. Then the anatomy, your skull would be the same, but most of the case it's not it's not the case actually. So this product for hearing aid is custom produced for your ear. Another example is as well that 3D printing for the medical practice has enabled the reducing of the surgery time. And one example here, very powerful, is to show you that in the past, in 2001 and 2002, so it's not a technology that has been invented 2 weeks ago, surgery time has been reduced from 97 to 23 hours. And this is amazing, actually. If we have a look at this case study, those little Siamese twins here are binded to one another by their skull. And, well, of course, we would like to separate them and to give them a healthier life as well, and maintain them alive as well. And as you would imagine, this is a very highly complex procedure. And such a procedure is actually very rare, so it doesn't happen and occur very often. And when surgeons are confronted with this case, well, they have either to improvise or work 97 hours straight in order to, well, bring a solution to this case. So what 3D printing did here is to help to reduce the surgery time and to bring an easier solution for the surgeons here as well. So as you can see, the problem here was not only that their skull was binded together, but as well the veins bringing the blood here were merged together. So in order to separate them, well, surgeons had to decide what tools to use, where to cut, and how to cut. And being able to rehearse the procedure before the operation, well, this was a real game changer for this case study. And this is an example of, well, what has been 3D printed. It's a patient model here of the skull. And you see that there are two different colors, actually. So when the translucid and white one is more the skull, the anatomy, and the blood vessels in red here are represented as well. And this model enabled the surgeons to rehearse the operation before the surgical act, reducing the time from 97 hours to 23 hours. Now imagine working 97 hours straight with the same concentration you would have the first minute and the last minute. So this is actually amazing. 3D printing brings as well a solution when there's no other solution, especially for the medical field. And for this case study, this was a very old patient as well, and she had a bone cancer on the jaw. And, well, the surgeon came to a conclusion that the current technologies and, well, practice was not enabling a solution for, well, helping this patient. So what we did here is to recreate an entire jaw as well in order to provide a solution for the surgeon. And as you can see, it is patient-specific, that's one thing, but it matches exactly the functions and the weight of the previous jaw, the bone. And this one has been printed in titanium. So how does it work, actually? Well, this is a video here showing how the patient is inserted in a CT scanner, and what you obtain from the CT scanner are 2D files from the skull and the soft tissue, and you can retrieve from that information, well, the skull structure, for example, the bone, recreate a 3D file progressively, and then have it printed either, well, for a rehearse function, like, for example, the skull here, which is in a polymer then, and print as well the patient-specific implant. And you can scale it up, you can scale it down, you can have markings on it, you can cut it as well to have only a portion of it. So this is very interesting for the surgeons here. And another application, so this is exactly what we did on this one here as well. This is a skull printed from a patient who suffered from a bike accident, no helmet. and think about this. And the solution, well, as you can see, is that it is highly complex to produce an implant that is patient-specific. And with this technology, 3D printing enables actually, this is a PEEK implant, to provide a solution that is patient-specific and that fits perfectly. Another thing is that 3D printing is actually saving lives. And for this case study, this was done in Michigan on this little boy, 20 months old, and his problem was that his bronchus would, well, he suffered from a rare disease actually, and his bronchus wouldn't stop to collapse. So basically he couldn't breathe, and this was happening again and again and again, and the doctors actually thought, well, he wouldn't come out of the hospital. And what 3D printing, well, can do for this little boy was to provide an implant that is, well, that matches exactly the anatomy of his bronchus here. It's a splint here that has been produced in a biodegradable material. So this implant would then be put on the patient, on this little baby here, and would disappear progressively in time, saving the life of this baby as well. And this is where we're heading for. We can print today with metals, ceramics, polymers, biodegradable materials. Technology, it is a tool, a powerful tool. It enables surgeons to rehearse, to pick the correct instruments, the correct way and procedure to operate on the patient, save lives, bring a solution when there's not another solution. But it can go a bit further as well. And currently, researchers are working on, well, bioprinting, like it's called, or organ printing. And the idea is actually to use, well, stem cells from the own patient and combine them with growth factors and construct them, for example, on a biodegradable polymeric scaffold in order to recreate organs. And the first picture, or one of the first pictures I showed before, well, is this idea here as well, progressively introducing bioprinting and organ printing for the medical practice. So this is actually a good news for, well, big smokers or heavy drinkers. They could, well, endlessly drink and smoke, do both together, without even, well, thinking about the consequences, and live on and on and on for 200 years. Is this maybe the idea we want to give with technology and the medical practice? Or do we use it for specific cases, like, for example, well, in the case of a little baby? When, where, with what technology and what materials? Well, the real question with those, well, with this technology especially, would be actually, how far can we go? Thank you.